From New York, this is Democracy Now!
South Africa may unfortunately be a precursor. It may be a warning for what will happen in the rest of Africa.
I'm very, very worried. I think everyone should. It's something that is challenging a human life. It's something that can kill.
COVID-19 infections are skyrocketing in South Africa, now 5th in the world for coronavirus cases, with an already fragile hospital system. We'll look at how the African continent has so far avoided the worst of the pandemic and at new vaccine trials underway in South Africa. We'll go to Cape Town and then to Ethiopia to speak with the head of the Africa Centers for Disease Control and Prevention. Then, as the pandemic surges throughout the United States, we'll look at the impact on Latinx apparel workers, meat packers, and farm workers who've been particularly hard hit.
All us farm workers are making a big sacrifice out of necessity for hunger, to be able to feed our families and to have a place to live.
We'll speak with Dr. David Hayes Bautista, head of the UCLA Center for the Study of Latino Health and Culture, and author of a new report that shows Latinx Californians between the ages of 50 and 64 have died at more than 5 times the rate of white people of the same age. All that and more coming up. Welcome to Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman. The United States recorded more than 1,000 COVID-19 deaths Tuesday, the highest figure in nearly 2 months. On Tuesday, President Trump held his first televised briefing on the pandemic since April. After months of downplaying the coronavirus and claiming it was dying out, Trump admitted the crisis will continue to worsen.
It will probably, unfortunately, get worse before it gets better. Something I don't like saying about things, but that's the way it is. It's what we have. You look over the world, it's all over the world.
Trump did not invite Drs. Anthony Fauci or Deborah Birx of the White House Coronavirus Task Force to speak at the briefing. He didn't have any scientists at the briefing. Trump falsely claimed the United States has a lower fatality rate than, quote, almost everywhere else in the world. But the United States actually has the world's 10th highest rate of reported deaths and by far the most total deaths and infections. It has a quarter of the deaths in the world as well as infections. The U.S. death toll has now topped 142,000 and nearly 4 million Americans have been infected, though both numbers are believed to be undercounts. In California, Los Angeles is on the brink of shutting down again as coronavirus cases continue to soar. This comes as California has overtaken New York as the state with the most coronavirus cases, with just over 409,000 confirmed cases. The death toll in New York, however, is 4 times higher than in California. On Tuesday, the Centers for Disease Control and Prevention revealed the actual number of coronavirus infections nationwide may be 24 times higher than the public count. This comes as the Trump administration's opposing more federal funding for COVID-19 testing. The White House has refused to spend up to $8 billion already allocated for testing, even though many states and cities face severe testing shortages. In California, the coronavirus death toll at San Quentin State Prison has now reached 12. More than 2,000 men held at the prison have tested positive in one of the nation's worst outbreaks. In Texas, more than 500 women jailed at a federal medical prison in Fort Worth have tested positive for coronavirus, including National Security Agency whistleblower Reality Winner. In international news, Human Rights Watch is reporting at least 14 prisoners have died in Egypt's overcrowded prisons from COVID-19 complications. In Brazil, the coronavirus death toll has surpassed 80,000. 2 more government ministers in Brazil have tested positive, in addition to the president, Jair Bolsonaro. In Bolivia, police have recovered 400 bodies in recent days from streets, cars, and homes. Most of the people are believed to have died of COVID-19. In the the occupied West Bank, Israeli authorities have demolished a coronavirus testing center in the city of Hebron. In Iran, the health ministry reported 229 new deaths Tuesday, the highest daily total since the pandemic began. And the Gulf state of Oman is instituting a near-total lockdown, including nightly curfews and a travel ban. Meanwhile, the number of U.S. military personnel infected with COVID-19 has topped 20,000, raising growing concerns in Japan, South Korea, Germany, and other countries housing U.S. military bases, as well as in the war zones of Iraq, Afghanistan, and Syria. In Okinawa, Japan, more than 140 Marines have tested positive. The New York Times reports the infection rate in the services has tripled over the past 6 weeks. In immigration news, President Trump has signed a memorandum ordering the Commerce Department to exclude millions of undocumented people from the 2020 census that will be used to determine the number of U.S. House seats each state receives when voting district lines are redrawn next year. The unprecedented move reverses a long-standing policy of counting everyone, regardless of their immigration status, and is being denounced as an attempt to preserve white Republican political power. Civil and voting rights groups have already vowed to challenge the move. This is Ben Monterosa, advocate with the voting rights group Poder Latinx.
It's not only unconstitutional, it's illegal, and it's immoral. So one more time, the president is showing his true color of the racism that he has in his blood. Our community needs to be counted and will be counted for the good of our country and for the good of our community.
In related news, immigrant families and allies in Boston have been camping outside the Massachusetts State House since Friday, demanding state legislators include a provision in a racial justice bill that would grant undocumented people the right to get a driver's license. In Portland, Oregon, federal agents tear-gassed protesters Tuesday night, the 55th day of demonstrations in Portland against racism and police brutality. Over the past week, unidentified federal agents have been attacking anti-racist protesters, even snatching activists off the streets in unmarked vans. On Tuesday, the U.S. Department of Homeland Security's Customs and Border Protection arm confirmed it had deployed officers from 3 paramilitary-style units to Portland. Meanwhile, a leaked DHS memo reveals the agency is now conducting domestic surveillance targeting potential threats to federal buildings, as well as local statues and monuments. In Washington, the White House press secretary claimed President Trump had the legal right to deploy federal agents to Portland and other cities.
Yes, well, what you're referring to is Portland, and 40 U.S. Code 1315 gives DHS the ability to deputize officers in any department or agency, like ICE, Custom and Border Patrol, and Secret Service.
President Trump has threatened to deploy federal agents to other cities, including Chicago, New York, Philadelphia, Detroit, Baltimore, and Oakland. In other protest news, a Detroit police officer, Daniel DeBono, has been charged with multiple counts of felony assault for shooting rubber bullets at 3 journalists who were covering a Black Lives Matter protest on May 31st. If convicted, he faces up to 4 years in prison. In New York, at least 7 people have been arrested after dozens of police officers in riot gear pushed out the remaining occupants of a peaceful encampment outside City Hall. The raid occurred early this morning. Protesters with the Occupy City Hall movement had been camped out for over a month, calling on the city to cut $1 billion from the NYPD's $6 billion budget and reinvest the money into social programs. In other New York news, nearly a dozen unhoused people and allies spent Tuesday night camped outside the home of New York's Department of Social Services Commissioner, demanding the city provide permanent housing to unhoused people during the pandemic. The Democratic-controlled House has approved a $740 billion military spending package, a $2 billion increase from the previous year. A group of anti-war Democrats had pushed for a 10% Pentagon budget cut, but 139 House Democrats joined with the Republicans to defeat the measure. Over 100 House Democrats also joined with Republicans to reject a proposal to accelerate the withdrawal of U.S. troops from Afghanistan. Congressmember Ilhan Omar, who had submitted the proposal proposal, tweeted, quote, 20 years later, Congress is still not willing to support withdrawing our troops from Afghanistan. Endless wars continue to take lives and disable so many. It's long past time to end this war, she said. In other news from Capitol Hill, the Senate's rejected a bipartisan effort to limit the transfer of military gear, including tear gas, grenade launchers, and weaponized drones, to local police departments. The United States has abruptly ordered China to close its consulate in Houston within 72 hours. Within hours of the order, smoke could be seen from the consulate's courtyard, where it appears Chinese consulate workers were burning documents. A spokesperson for China's foreign ministry called the closing of the consulate illegal under international law.
The unilateral closure of China's consulate general in Houston within a short period of time is an unprecedented escalation of its recent actions against China.
The State Department said the move to close the Chinese consulate was needed to, quote, protect American intellectual property. On Tuesday, the Justice Department indicted 2 Chinese residents, accusing them of stealing trade secrets from U.S. firms, including research into a coronavirus vaccine. The FBI has arrested the Republican Speaker of Ohio's House of Representatives, Larry Householder, in connection with a $60 million bribery scheme. Householder is accused of helping pass a $1.1 billion bailout of 2 nuclear plants after his political operation received $60 million from the owner of the plants, First Energy Solutions. The company is not facing charges and is not named in the indictment. 4 others were arrested Tuesday, including the former chair of the Ohio Republican Party, an aide to Householder, and 2 lobbyists. In Chicago, at least 15 people were wounded Tuesday night in a mass shooting outside a funeral for a man who was shot to death last week. Passengers in an SUV reportedly began shooting at funeral attendees as the vehicle drove by. A group of those attending the funeral then reportedly started shooting back, causing the vehicle to crash. The occupants fled. At least 6 people who were hit are in critical condition. In news from Africa, the trial of former Sudanese President Omar al-Bashir began Tuesday. He's facing charges stemming from his role in a 1989 coup that brought him to power. In London, the acclaimed fashion designer Vivienne Westwood locked herself inside a giant yellow bird cage outside a London court Tuesday to protest the ongoing jailing of WikiLeaks founder Julian Assange and his possible extradition to the United States.
I am Julian Assange. I am the canary in the cage. He has been trapped by a big net, taken out of the sun and shoved in a cage. And the problem is they want to send him to America for a sentence of 175 years and stick him in a concrete block for a jail. And this could happen to every journalist.
On Tuesday, President Trump weighed in on the arrest of Jeffrey Epstein associate Ghislaine Maxwell, who's facing child sex trafficking charges. Trump was asked about her arrest during his coronavirus briefing.
I haven't really been following it too much. I just wish her well, frankly. I've met her numerous times over the years, especially since I lived in Palm Beach, and I guess they lived in Palm Beach. But I wish her well.
In news from Capitol Hill, Democratic leaders are calling for Republican Congressmember Ted Yoho to be sanctioned after he was overheard calling Congresswoman Alexandria Ocasio-Cortez an effing B-word on the steps of the Capitol. His remarks were overheard by a reporter for the Hill newspaper. ABC reports it's been nearly a century since a member of Congress was censured for using unparliamentary language. Ocasio-Cortez responded by writing on Twitter, quote, "Bitches get stuff done." And those are some of the headlines. This is Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman in New York City, joined by my co-host Juan Gonzalez from his home in New Brunswick, New Jersey. Hi, Juan.
Hi, Amy, and welcome to all of our listeners and viewers across the country and around the world.
Well, we turn now to South Africa, where skyrocketing COVID-19 infections have made the country 5th in the world for coronavirus cases, overwhelming an already fragile hospital system and signaling a dangerous turn for the African continent, which has so far avoided the worst of the pandemic. South Africa recorded nearly 382,000 cases as of Wednesday, a number that's certain to be an underestimate. So far, the death rate in South Africa has remained low, even as case numbers soar, with nearly 5,400 reported fatalities, but South African President Cyril Ramaphosa said the number of deaths could reach 50,000. The virus poses a particular threat to poor South Africans who are less able to socially distance and access adequate medical care. Half of South Africans live in poverty. 1/3 of South Africans are unemployed. At least 3 million people have lost their jobs due to the pandemic. In response to the rising numbers, the president's banned alcohol sales, mandated mask wearing, and imposed a curfew. This comes after South Africa took aggressive action to curb the virus in March, implementing a shutdown, then rolled back restrictions facing an economic crisis. This comes as University of Oxford vaccine trial has shown promising results. But researchers say the study will face a challenge in South Africa, where scientists are trying to sign 2,000 people up for a vaccine trial while the numbers surge. This is the head of the trial in South Africa speaking to CNN.
It might well be that we fail, not because the vaccine doesn't work in protecting people, but simply because the force of exposure is so tremendous. So this is really going to test the mettle of this vaccine.
For more, we go to Cape Town, South Africa, where we're joined by the South African human rights lawyer and HIV, AIDS, and social justice activist Fatima Hassan. She's founder and director of Health Justice Initiative, an organization focused on public health law and equity. Previously served as special advisor to South Africa's former Minister of Health. Her recent op-ed in the Daily Maverick is headlined, "A COVID-19 Vaccine When Solidarity Meets Nationalist Profiteering." Welcome to Democracy Now!, Fatima. It's great to have you with us. Why don't you start off by talking about the scope of the crisis, the pandemic in South Africa, and then particularly what's happening around this Oxford vaccine trial that needs something like 2,000 volunteers, but finding those who are COVID-free is very difficult.
So first, thank you, Amy and Juan, for having me on the show. It's great to be on. So I think the first issue with the trial is that what's significant is that the president and the government agreed to offer solidarity and participate in the trial, which is being led by Oxford University through South Africa's Wits University. The difficulty, of course, is one, trying to secure a sufficient number of volunteers for the trial, with, as you correctly point out, within a climate where the numbers of people living with COVID are increasing, and we also estimate that that is a significant undercount because our testing strategy has been hampered by the lack of available testing kits. So the criteria for testing has changed, and in effect, it amounts to rationing at the moment. The second issue with the trial, which actually is, involves quite significantly a pharmaceutical company called AstraZeneca. And the issue around AstraZeneca's relationship with Oxford, the relationship with the South African government, as in the contractual relationship, including Wits University and clinical participants in other parts of the world, in Brazil as well, is unclear. We're calling for transparency in those agreements, because on the one hand, if we are going to participate in a trial that is trying to ensure equitable access to a vaccine, if it is successful, then certainly there has to be a framework where equitable access can actually be achieved. And we certainly don't want to be in a situation like we were in, during the HIV/AIDS crisis, where wealthier countries are able to access a vaccine much sooner, or some countries in Africa are able to access life-saving vaccination and treatment, and others are not.
I'd like to ask you specifically about this issue. You mentioned trials in Brazil as well. Is there a situation already developing where the testing of vaccines is occurring in the third world, but the initial beneficiaries of any vaccines will be in the advanced developed countries?
So certainly there's a concern that there are countries that have volunteered to participate in the trial, including in the Global South. But the terms and the conditions for what access would mean if the trial is successful is uncertain and unclear. I think what is, concerning is that people are labeling it the Oxford trial, but we know that there's deep involvement of AstraZeneca, and the terms and conditions between Oxford University and AstraZeneca is not available. And this, you must remember, is only one of a possible 126 vaccine candidates. About 20 to 22 are in the second phase of clinical testing, and there's very few, a handful of candidates that still will go to phase 3. So the participation of the Global South in one or two of these trials is significant because we need to do that. We need to participate. We need to offer our solidarity. We need to find a solution to this crisis. However, the chances are that, like HIV/AIDS, like a lot of life-saving medication and treatment, we're going to be last in the line unless we can guarantee and ensure that the vaccine is freely available, is equitably available to all people in all parts of the world. There's a campaign which is being led in the US called Free the Vaccine. Our president, Cyril Ramaphosa, as head of the AU, has supported the people's vaccine. But, what we're saying is that all of these are really beautiful and lovely words and statements, but they don't sort of create any enforceable guarantees because, like with HIV/AIDS, what we've realized is that if you rely on the benevolence and the charity of this particular industry that is investing millions and millions of dollars in the development of a vaccine, then that won't guarantee access for the Global South.
Well, Fatima Hassan, I wanted to ask you in terms of the situation in South Africa itself with the pandemic. You've said that your country has used a first world response for a third world country. Could you talk about the situation right there in South Africa?
So I think the situation is worsening. I think we're in a crisis. Our health system really, in my view, both the public health service and the private health service is taking significant strain. Frontline workers are getting sick, are getting exposed, repeatedly to COVID, are at risk. They don't have sufficient supplies of PPE due to global hoarding. We don't have sufficient supplies of testing, again, due to the global geopolitical situation and the reliance on pharmaceutical companies that still insist on holding their patents or only giving partial licenses to other companies that could produce those testing kits. So the situation is one where more people are getting infected. We believe that the death count is underestimated. A lot of people are dying alone at home without a COVID test. People are still struggling to get death certificates. So you are dealing with a public health crisis in the middle of a global pandemic where inequality is soaring as a result of COVID and as a result of the socioeconomic effect of the lockdown. What we have in South Africa at the moment is increasing joblessness with increasing COVID infections. And the people who are most at risk are low-income workers who are required to reopen the economy, who have to rely on public transport, who have to go to work, who have to serve people who want, to have the luxuries of a normal society. So I really think it's our inequality reckoning moment. All of the fault lines of South Africa's post-apartheid democracy and its inequality and its violence is actually coming to the fore. The interaction between what we're seeing in relation to COVID and the morbidities that are playing out, the interaction between COVID and the comorbidities of people living with HIV, people living with TB, people living with cancer is significant. And I think that's another reason why our healthcare system is also taking strain. What is important, and I should point out, is that unlike HIV/AIDS, our government's initial response and up until today has been rooted in science and evidence. But that science and evidence is a first world science and evidence. It's designed for countries where people can stay at home and can work from home, where they have secure employment. It's designed for countries where there's sufficient socioeconomic rights protection and benefits if you are unable to go to work. It's designed for countries that can socially distance, where you don't have thousands of informal settlements that are densely populated. It's designed for countries where there's proper sanitation, where there's running water for every single person in that country, where there's secure food supplies. So, like I said earlier, I think the fault lines of inequality in South Africa is coming to the fore, and the crisis of our health system, which, as you'll recall, because of apartheid, is a dualized healthcare system that is basically based on race and class, where the rich can afford really high-quality private healthcare, and the poor have to rely on high-quality but inconsistent access to healthcare services. We already have multiple provinces that are really taking strains. These are provinces we call the neglected provinces, where the health systems have basically collapsed, where the national government is probably going to have to intervene and step in and take over the running of those health departments.
Fatima Hassan, I want to thank you so much for being with us. South African human rights lawyer, HIV, AIDS, and social justice activist, founder and director of Health Justice Initiative, previously served as special advisor to South Africa's former Minister of Health. We'll link to your piece in the Daily Maverick, headlined "A COVID-19 Vaccine When Solidarity Meets Nationalist Profiteering." When we come back, we go to Ethiopia to speak with the head of Africa's Centers for Disease Control. Stay with us.
One day, my people, one day we'll be celebrating, 'cause this plague is over. Nothing will be separating us, 'cause nobody is safe until everybody is safe. Oh, everybody is safe. Oh.
Rain no go fall forever. Sun goes to shine, my sister. We go beat Corona if we stand together. If we stand in solidarity, we no go fit to fall down, fall down. Yeah, me I like that. Me I like you and I know you like me too. Me I love you and I know you love me too. We gonna spread the word.
Stand Together, an African anthem of solidarity against COVID-19. It features a wide swath of African musicians from around the continent, including Nigeria, Tanzania, South Africa, Cameroon, Angola, Ethiopia, and Morocco. This is Democracy Now!, the Quarantine Report. I'm Amy Goodman with Juan Gonzalez. As COVID-19 cases skyrocket in South Africa, the World Health Organization warned this week the spike in infections could signal an impending acceleration of the coronavirus across Africa. This is Mike Ryan, Executive Director of Health Emergencies, speaking Monday.
I think what we're starting to see is a continued acceleration of transmission in a number of countries in sub-Saharan Africa. And I think that has to be taken very, very seriously. South Africa may unfortunately be a precursor. It may be a warning for what will happen in the rest of Africa. Many of those countries exist in the midst of fragility and conflict. Many of them need external help and support.
As South Africa's case numbers rise, countries across Africa also are seeing a spike in numbers. Al Jazeera reports cases in Kenya increased by more than 30% in the past week. Numbers are up by 50% in Madagascar, 69% in Namibia. This comes after Africa had so far escaped the worst of the coronavirus pandemic, with countries such as Rwanda implementing stringent public health policies to prevent the spread. The death rate in Africa has also been low. For more on COVID-19 in Africa, we go to Addis Ababa, Ethiopia, where we're joined by Dr. John Nkangasong, the director of the Africa Centers for Disease Control and Prevention, formerly with the Centers for Disease Control and Prevention in the United States. Dr. Nkangasong, it's great to have you with us. Thanks so much for taking the time in this time of crisis and pandemic to speak to us. Explain the issue in Africa right now. We have seen it as so far being spared from what the United States is going through. But is that a matter of lack of testing, or are the numbers, do you believe, truly low on infections and deaths?
No, thank you for having me on your show, first of all. And we have always been very clear that the pandemic in Africa was a delayed pandemic, that the continent wasn't spared, but rather that because of the aggressive measures that were put in place very early on due to strong leadership from the different countries and a strong coordinated approach from the African Union and the president of South Africa in his capacity as the chair of the African Union, that helped to blunt the pandemic. And I think it was always clear in our mind as the Africa CDC that this pandemic was going to gather momentum. And here we are with the situation. I'll call it the second phase of that, where countries are beginning to see dramatic increases in the number of cases. An example is the South Africa you just mentioned. So our pandemic is heterogeneous. We should be very careful the way we look at the numbers. We still have over 40 countries with less than 10,000 cases. And then South Africa is constituting more than half of the about 750,000 cases on the continent. But the general trend is in the upward swing mode.
And Dr. Nkangasanga, in terms of the prior experience of public health officials in Africa in combating other health threats and pandemics or epidemics like Ebola and HIV/AIDS, what has the public health infrastructure as a result been more prepared this time around for COVID?
So, somehow, yes. If you look at the countries like Sierra Leone, Liberia, and Guinea, where they were heavily hit by the Ebola outbreak in 2014, you see that, I mean, they have, after that period, developed their national public health institutes. They strengthened their community health workers program. That is extremely important for contact tracing. And that has helped those countries, especially in what I call the phase one of the response. I mean, absolutely no doubt about that. The overall awareness of the threat of diseases had also heightened because of Ebola and HIV there. If you look at South Africa, I mean, I know that the situation in South Africa is changing dramatically, but we should always remember that the initial response was very critical. Otherwise, we would probably be at 1 million or more than 1 million cases in South Africa. So that experience that Africa is used to fighting HIV, tuberculosis, malaria, Ebola is very important. But we should always remember that this is a different virus. This is different from Ebola. The transmission patterns is different. It's affecting everybody at the same time. It's not restricted like Ebola was in DRC or in West Africa. And it's very different from HIV. So I think we are learning as the continent is adapting its strategy. We are learning that this is a very different enemy we have to fight.
And Doctor, what about the whole issue of testing accessibility for COVID-19? What's it been like? Are there particular countries that are more ahead in this area? And what do you see as what needs to be done?
No, that's a very good question. I mean, the continent has come a long way. Let's be very clear. We were extremely challenged with the issues of testing, not because the continent doesn't know how to test, but just because we didn't have the reagents for specific for COVID. If you all recall, in February, just 2 countries had the capacity to test for COVID on the continent. Again, we ramped that up very quickly, the capacity, by training large number of countries in Senegal and South Africa. And within 3 weeks, starting the end of February to March, we were able to ramp that up very quickly to about 43 countries. Today, as a continent, we have tested about 7 million or conducted about 7 million COVID tests. And if you compare that with just 2 to 3 months ago, we're still under 500,000 tests. So I think the testing has picked up. But we are not yet there. I mean, as a continent of 1.3 billion people, we should be testing about 12 million conducting about 12 million COVID tests a month. So I think we still have a long way to go in order to catch up and be where we have to be. So testing still remains a challenge. The appropriate testing, though, is also important. The so-called polymerase chain reaction-based testing is good, but it's very tedious. It requires a long turnaround time. The type of tests that we need are those point-of-care tests that we can easily decentralize into the communities and do the testing, followed by the contact tracing, isolation of patients, and then taking care of them for those that are infected. That is why we've launched the initiative called the Partnership to Accelerate COVID Testing on the Continent, that is underpinned by the ability to test, to trace, and to treat. I think we are slowly catching up on the goal of testing 10 million people. As I indicated, we've conducted about 7 million tests. The Africa CDC continues to roll out testing reagents to many countries. So I think we are slowly catching up on testing, but again, it has been a serious challenge for us.
Dr. Nkangasanga, I wanted to ask you about the importance of the World Health Organization and President Trump pulling the United States out of it. And that leads to my second question about global cooperation and how important that is. Right now, we've had the United States joining with Britain and Canada saying Russian hackers are stealing vaccine information. And now you have the indictment of 2 Chinese people in the United States who President Trump says has also hacked vaccine information. But why are we talking about this? What about global cooperation on this critical issue, where this is really open source, so we come up with a vaccine that works for everyone? Both of those issues, WHO and vaccine, global cooperation.
So let me start with the cooperation piece. If you look at the joint continental strategy that Africa has put forward, it is underpinned by the need for strong cooperation, the need for strong collaboration, the need for strong coordination and communication. Those are the 4 C's that guide our continental strategies, which was endorsed at the highest level of the continent since February. So I think the continent recognizes that the victory, the global victory against COVID has to be guided by global solidarity because this is a global crisis and no country will be considered free of COVID if any country in the world is considered still has COVID infections. And again, a continent of Africa of 1.3 billion cannot be excluded in the equation in this whole discussion of eliminating COVID in the world. So I think, again, we strongly adhere to the principles of coordination, cooperation, and collaboration to seek solutions that will help us move us from it. This is a war of survival for the world. I think we've seen how the damage that COVID has imposed on our economies, on our lifestyles, and on the number of deaths that COVID has caused us. So again, this is not a fight that any single individual or region of the world will win without a global coordination and solidarity. With respect to WHO, I think our position is very clear that the world has always been a safer place. Our global health problems have always been solved adequately only with the leadership and strong leadership of the United States and of the World Health Organization. Absolutely, no doubt about that. The HIV/AIDS crisis, we begin to turn the fight against HIV/AIDS only when the United States launched the President's Initiative against HIV, called PEPFAR, in 2002, 2003. And the continent of Africa has benefited from that effort. I think the United States has invested over $70 to $80 billion in fighting HIV/AIDS on the continent, which the continent is extremely appreciative. Through solidarity and cooperation, the Global Fund was established in 2001, 2002, and it has been a game changer. It's probably a good example of how we should coordinate efforts to fight against COVID-19, which is the greatest challenge the world is having in the last 100 years. So I think the strong WHO and the strong United States leadership is the key ingredient for us to come out of this extremely devastating health crisis.
And Dr. Nkangasong, in terms of this issue of global solidarity, for years now we've seen a key feature of international trade agreements where the pharmaceutical companies and other corporations push the importance of intellectual property protections, obviously for patents, especially of medicines. Do you believe, given this crisis, that there should be a suspension of this race to control a particular vaccine and, in essence, make it available generically from the start to at least stem this epidemic, with possibly 5 or 10 years down the line, companies then trying to benefit once the world situation has stabilized?
I mean, that's a very important question. I think we, as the Africa Centers for Disease Control and the African Union Commission, issued a statement in that regard just a few weeks ago, to be very specific, on the 25th of June, where we convened a continental international conference on COVID vaccine. And that meeting was chaired by President of South Africa, His Excellency President Ramaphosa, and the chair of the African Union Commission, Excellency Moussa Faki. The essence of that meeting was clear, that we have to discuss the issues related to intellectual property. We have to discuss issues related to access to vaccines, almost in a timely fashion, if they're available for a continent of 1.2, 1.3 billion. And exactly what in that communique, we touch on the Doha Declaration, which speaks to this intellectual property you just mentioned. I think we are always reminded of what happened in 1996 when the HIV drugs were available, and it took us about 7 years, up to 2002, before they became accessible to the continent of Africa. I think if that situation plays out now, you can see that the future of the continent will be completely on the balance. You see that the development of the continent will be on the balance. So I think, again, we are calling for a global solidarity to make sure that just speaking about access to vaccines in developing world and in Africa in particular is just not a nice word to say. It's not just a feel-good word to say, but it's a reality. And we're developing our own strategy called African Access Vaccine Strategy, underpinned by access and development of the vaccines for the continent.
Dr. Nkongasong, we just have a minute, but I wanted to ask you about the connection between COVID transmission and war. In our headlines, we just read about U.S. soldiers around the world, and particularly in Japan. There's an outbreak of COVID-19, what this means for local populations. You have talked about that connection going back to the Spanish flu and how this can be dealt with, war, conflict, and pandemic.
I think there's always that strong interaction between war or crisis and disease outbreak or pandemic, the ability to control that. There is no chance that the Spanish flu in 1918 happened just after the Second World War. After the First World War. So I think it's very clear that these two are very, very interrelated. And I'm very concerned that a continent of ours with so many hotspots where you have conflicts going on will be sooner or later be affected by the COVID-19 pandemic, and it will become extremely challenging to fight the war against COVID in those regions. So I think you begin to face a double war in a single country or in an entire region. We must put that into our continental strategy to be able to make sure that we're prepared to root out COVID when they finally get into those conflict regions. But very importantly to end will be that this is the time for us to silence the guns, silence all the guns everywhere in Africa so that we can fight this common enemy.
Dr. John Nkongasong, thank you so much for joining us. Director for Africa's Centers for Disease Control and Prevention, trained as a virologist who used to work at the Centers for Disease Control. When we come back, as the pandemic surges throughout the United States, we look at the impact on Latinx workers, apparel workers, meat packers, farm workers, so hard hit. Stay with us. Musician and teacher Cosmas Magaya of Zimbabwe, who died earlier this month of COVID-19. This is Democracy Now!, the Quarantine Report. I'm Amy Goodman with Juan Gonzalez. States like California see a surge in coronavirus cases and hospitalizations. In fact, California has just surpassed New York in number of cases, though it has a quarter of the deaths of New York. The Latinx community has been especially hard hit. A new report shows Latinx Californians between the ages of 50 and 64 have died at more than 5 times the rate of white people of the same age. The report from UCLA, the University of California, Los Angeles, links the trend to the fact that Latinx workers make up the bulk of agricultural workers who are high-risk essential workers. In a frontline PBS documentary called COVID's Hidden Toll that aired Tuesday night, farm worker Cynthia Hernandez describes how she has both cancer and diabetes, which put her at a higher risk for complications if she were to contract COVID-19, and that the contractor she works for requires her to bring her own mask.
All us farm workers are making a big sacrifice out of necessity for hunger, to be able to feed our families and to have a place to live. Those of us who are working have so much debt and bills to pay that the money sometimes isn't even enough to buy one mask, because each mask costs $3 or $4 at the store. And it's disposable.
Likewise, a report from the Centers for Disease Control found 87% of workers infected on the job at meat processing plants are people of color. Because of the surge of cases in Los Angeles, it may soon face a second stay-at-home order. This comes as a Los Angeles apparel factory that employs mostly Latinx workers to produce face masks has been shut down after health inspectors found, quote, flagrant violations of infection control orders. More than 300 workers at that one factory tested positive for COVID. 4 died. The company is run by Dov Charney, former CEO of American Apparel, who was ousted amidst allegations of misusing funds and allowing sexual harassment. Workers said the company failed to clearly inform them when people got sick or enforce social distancing. For more, we're joined by Dr. David Hayes Bautista, Distinguished Professor of Medicine and Director of the Center for the Study of Latino Health and Culture at the David Geffen School of Medicine at UCLA. It's great to have you with us, Dr. Hayes Bautista. Can you start off by talking about LA Apparel? 300 workers found positive, 4 died at least at this point. What do you know about that? And then move on to farm workers.
Well, actually, both of them are related because these are structural situations. What we've noticed is that as soon as the state was locked down the first time early in March, people were told to work from home, take their children out of school. The children would do their lessons at home and to leave the house only to buy groceries or the bare necessities. Well, what we discovered about a month and a half in is that the essential workers are not only just the nurses and physicians, who, by the way, are trained to go into dangerous situations. They have personal protective equipment. They're trained to use it. The question was just getting enough to them. But other workers were also as essential in order for the higher income families to shelter in place, starting with the farm workers, who, of course, cannot plant strawberries from home. They have to go out on the job. They're working in large crews. They're transported in buses. Some of them sleep in barracks. And as we look at the chain of food, the truck drivers, the packing house workers, the slaughterhouse workers, the grocery store shelf stockers, the grocery store checkout clerks, for Pete's sake, a checkout clerk would have possibly a couple of hundred people pass within an arm's length of the checkout stand, and for 2 months they were not even offered personal protective equipment. Now we're seeing this in more industrial, such as the apparel companies, where again for a long time we've had costureras working at the bottom, if you will, of the economic chain, paid very little, rarely offered health insurance, rarely offered any education about what's going on, and now we're seeing the effects of all of this. So what we see at a large scale is that Latino and people of color basically do the scut work that keep the state going, its economy going, but get very little of the resources, very little pay, very little health insurance, very little access to care. And this particular pandemic is now exposing these inequities.
And Dr. Hayes Bautista, in terms of given that the Latino population of the United States is significantly younger than either the white population or the African-American population, and that this disease is especially hits hard in terms of fatality at the elderly, you would expect much lower death rates among Latinos just because of so much of the population is young. Yet you're finding, at least especially in the 50 to 65 age range, this enormous disparity in terms of deaths among Latinos. How much of that do you sense is actually as a result of the working conditions that they're being subjected to, or how much of it is part of the underlying health conditions, whether it's diabetes or hypertension or other health conditions that many Latinos face?
Older populations always have higher death rates for almost anything compared to younger populations. But what's important here, yes, younger Latinos have a lower death rate than older Latinos. However, when we look at younger Latinos and younger non-Hispanic whites, the Latinos have about 4 to 5 times the death rate of whites. So clearly something is not working even within that younger population. And again, this has a lot to do with both working and living conditions. We've outlined some of them. Let me just go into more detail. Latinos, even after Obamacare, consistently are twice as likely not to have health insurance. Latinos, for a number of reasons, are faced with a huge doctor shortage, much less being able to find doctors that speak Spanish. And by the way, medical services have been provided in Spanish in California for 251 years. So this is not like this is something suddenly a new problem we've discovered. This has been a problem ever since 1848. So if you remember the early days of the pandemic, Hollywood was able to get access to tests almost immediately. The Lakers got their tests immediately. Those who had access to, it's called boutique medicine, got their tests immediately. Well, some of these tests can cost up to $2,000 depending on where you're getting them. If you don't have health insurance and you hear that a test can cost hundreds or thousands of dollars, if you don't have access to medical services or particularly ones that you can communicate with, this creates a problem. And early in the pandemic, the California Department of Health sent out an advisory note in Spanish, God bless them, and it said, if you have the symptoms, you have a high temperature, you have a dry cough, hable con su médico pronto. Talk to your doctor now. But what if you don't have a doctor? You don't know how to pay a doctor. So many people were not able to. Thus, they continued to work without the personal protective equipment. They were exposed to the coronavirus at much higher rates than people that were able to shelter at home. And not surprisingly, we started to see the case rates mount, particularly after about 6 weeks into the coronavirus pandemic. And now it's progressing to full-blown cases of COVID disease. And, of course, now the mortality. So that's the working part. But then there's the domestic part. Housing is expensive in California. There's no question about it. And Latinos occupy those positions, occupations, and industries that pay very, very little, don't provide them health insurance usually. So in order to live, Latinos tend to have more people per household. And this has been a classic pattern. So you'll also have more multi-generational households. So it could be that, yes, the kids are no longer in school. They're at the house. You have the abuelos, you have the grandparents. But you also tend to have, because of low wages and high costs of housing, more multiple wage earner households. That is, the adults, more of them are going out to work because they just need to, because it's hard to live here, which means even though the rest of the household may be sheltering, they are going out and being exposed to coronavirus and bringing it back into the household. So now we're seeing the result of all of these issues compounded. The Latino physician shortage is so great in California that the rate at which all the California medical schools graduate Latino physicians, it will take 500 years to make up the shortage for the year 2015. So I can imagine, here's Senora Gomez. She's feeling, I've got a high temperature, I've got a dry cough, I need to go see the doctor. Oh, come in, Senora Gomez. Oh, you have the symptoms? Take a seat, and the doctor will see you in 500 years. That's why we have a problem.
I want to go to the issue of the meat packers. For example, the JBS beef plant in Greeley, Colorado, the site of the deadliest workplace COVID-19 outbreak in Colorado, where at least 286 workers tested positive for COVID-19 and 6 died. The United Food and commercial workers put up 2 billboards in Greeley to remember those who died. This week, JBS agreed to a $1.85 an hour wage increase after many of the workers walked off the job earlier this month. UFCW Local 7 responded by calling on JBS to improve safety measures and what it called its work while sick culture. That's one company in one state. President Trump tried to prevent meatpacking plants from being closed, and you have throughout states thousands and thousands and thousands of meatpackers being infected with COVID-19, many dying. Can you talk about this, Dr. Hayes Bautista?
Well, yes, not only meat packer, any production where you have to have a lot of workers standing in close contact either with one another or with clients. We could say the same thing with grocery store checkout clerks, without providing them the education, without providing the personal protective equipment, without providing them with health insurance or sufficient wage that they could buy health insurance. This is all a recipe for a quick spread of the coronavirus, and we're seeing it play out.
And Doctor, I wanted to ask you, Senate Majority Leader Mitch McConnell, every other word out of his mouth the last few weeks has been that a new congressional bill to address the pandemic must include ending of removal of liability for employers in terms of their workers getting sick. Given the reality that OSHA, the federal agency in charge of workplace safety, is virtually non-existent these days in terms of what it does, do you think that it's advisable for the Democrats to agree to remove liability from employers if they're not properly protecting their workers?
Well, not only is it not advisable, but if you remember, the first CARES Act, the COVID Relief Act, specifically excluded any household in which at least one member was a non-citizen. Now, we're not talking about undocumented. We're talking about non-citizens. So you have a green card holder who's maybe been here 20, 30 years, has not yet taken that last step to naturalize. The whole household was penalized. They got none of the benefits that everyone was worried that are expiring for everybody else. Latino businesses got very little of the business support. So here we have a population that gets very little from the sources of support, and yet now even the legal route is being closed off if, in fact, their employers are held not liable. And I'm wondering how many of these employers, by the way, even bother to offer health insurance, and usually such employers do not. So it's putting this entire population at risk. Nonetheless, and let me hasten to point out, the 60 million Latinos in the United States 2 years ago created the world's 8th largest economy, 2.3 trillion. And that's with all these obstacles, all these barriers, all the name calling. Just think if we actually invested the way we invested in the rest of the country.
So, Dr. David Hayes Bautista, your state, California, has exceeded our state, surpassed New York in number of COVID infections. Of course, we don't really know the number of COVID infections anywhere in this country. It's considered a far underestimate. CDC thinks something like 24 times higher. But can you explain what's going on? Also, what's happening on the border with people who are living on the border? You mentioned undocumented, but what about actually undocumented people in this country having access to health care? And the fact that the Trump administration has not made use of $7 to $8 billion that were allocated by Congress for testing, for masks. And you have this incredible, severe shortage of all of these things right now, and how that particularly affects the Latinx community.
This is a case in point. If you remember the first days of the lockdown across the country in early March, mid-March, early April, and people ran to the grocery stores, and there was a run on certain products, such as, remember, paper towels and toilet paper, and people were fighting in the aisles over bales of paper towels and toilet paper. In California, 100% of the farm labor workforce is Latino. It's 100% Latino immigrant, and probably 60 to 80% undocumented. Now, what's interesting is that early on, these farm workers are considered essential employees. In fact, they were given letters that would allow them to actually travel to work without being stopped. And yet, they could also be deported at any moment. So between the deportations, between COVID and everything else, if these farm workers are not allowed at least the opportunity to live, who is going to grow the food? And we thought we were fighting over paper towels and toilet paper. Suppose we were fighting over the last sack of potatoes in the store. That could happen if this labor force were not here, yet we criminalize it. We put obstacles for access to care, and then we wonder if we're going to have a food shortage.
Language barriers, Dr. David Hayes Bautista, when it comes to getting information about COVID-19?
Medical services have been provided. In fact, we had the first smallpox vaccination campaign in 1803 in California in Spanish. We were part of Spain at the time. Medical services have been provided in California in Spanish for 251 years. We came into the United States as a bilingual state. Spanish was one of the official languages. And yet, Latinos are least likely to find a physician who speaks Spanish. The shortage is tremendous. But it's not because this is a new issue. This is California. What we have done for 160 years is chosen to turn our back on this population, not allow it access to the investments we're making in other populations, either for education or healthcare. They'll wonder why there's an issue.
Dr. David Hayes Bautista, I want to thank you so much for being with us, Distinguished Professor of Medicine and Director of the Center for the Study of Latino Health and Culture at the UCLA Medical School. I'm Amy Goodman with Juan Gonzalez. Stay safe.